Good afternoon. So I'm Christopher Millets, and I'll be presenting the Places in Communities program on behalf of Esther Vamos and Matt Egan. So in the 5 minutes I've got, I'll present a brief overview of the program and then some highlighted areas of activities. So the program speaks to a grand challenge set to SPHR by our local authority colleagues in that how they can best deliver public health programs and activities that reduce health inequalities in the context of lean fiscal environments. We know that since 2010, due to austerity measures, local authorities have experienced major cuts to their budgets. And we also know that due to the double hit to the public finances of Brexit and COVID, that this lean fiscal environment is likely to continue for some time. We're supporting local authorities through two work streams. Work stream A seeks to identify strategies that they can undertake to reduce health inequalities within the context of these lean fiscal environments. So learning from decisions taken around how they've prioritised services and activities in the context of the cuts, what sort of efficiency savings they've sought to make, and whether they've identified new revenue streams. In workstream B, we seek to identify low-cost or revenue-raising interventions in both the food and transport systems. So this could be new taxes, for the example of road user charging. Within workstream A, colleagues have characterised the level of cuts in different services. So here we can see cuts to local authority expenditure on both Sure Start and the early years services. So in addition to the overall cuts, we can see that the greatest cut actually fell on local authorities serving our most deprived communities in England. So colleagues have then sought to characterise the implications of these cuts for health outcomes. And here they've estimated that for every £10 reduction in spend in children's services is associated with an increase in the rate of children being taken into care of 2 per 100,000 children. So substantial and important health implications of the cuts. In workstream B, we're working with local authorities and communities to identify options for leveraging road user charging to improve population health. They're working with us to identify road users charging options in local areas. We're then using data from the literature, but also from retrospective evaluations of existing programs. And we're putting that data into models to estimate going forward what the likely health and environmental benefits of road users charging would be if local authorities adopted this policy. In the area of food systems, we've got quite a bit of focus on supporting local authorities to better implement existing regulations that they have to constrain the spread of takeaways and fast food shops. And as a component of this work, we're seeking to better use routine data as a platform to evaluate these sorts of policies and policy strengthenings. So here, colleagues from Cambridge and elsewhere are training a computer model to identify the type of takeaways in local areas from their names. So we've got the example of the Codfather, which is obviously a local chippy. Finally, we've got some cross-cutting activities. You'll hear later in the meeting about our Natural Experiments and Public Health Network. We have a strong public involvement and engagement component, not only at program level, but throughout the individual projects, and I hope that's illustrated through the road user charging example. We're supporting junior researchers through PhDs and through doctoral and postdoctoral fellowship opportunities. And we're aiming to strengthen research capacity in local authorities as well. And additionally, we have a dedicated work package on knowledge translation as a big focus is to strengthen the opportunities to have policy impact with our research. So I'll leave it there and wish you an enjoyable ASM 2021. Thank you very much.
Hello, I'm Judy Kidger from the University of Bristol, and I'm one of the co-leads of the SPHR's Public Mental Health Programme, along with my colleagues Kate Walters and David Osborne from University College London. And I'm really pleased to introduce the programme to you today. So, public mental health is the art and science of promoting mental health and well-being and preventing mental illness. And our programme aim is to generate high quality evidence to improve the mental health of everybody across the life course and to support the work of practitioners working in public mental health. And we're pleased to say that we've got involvement across all the members of SPHR, and we also work in partnership with the McPinn Foundation and a group of peer researchers. Our programme spans 3 years from 2019 to 2022, and we have 4 ambitious aims during that period to achieve. The first one is to develop a conceptual framework for public mental health, identifying important determinants of mental health which are amenable to change, and also identifying the best outcome measures. Secondly, we want to identify promising policy and practice approaches that impact on these determinants. Thirdly, we want to evaluate the feasibility, effectiveness and impact of delivering the most promising interventions more widely across England. And our final aim is to evaluate promising interventions that tackle social and economic inequalities in order to improve mental health using a range of methodological approaches. And I'm really pleased to hand over now to our programme manager, Jen Dykeshorn, who's going to talk about some more of the details.
I'm now going to provide you with a very quick overview of some of our findings to date, as well as what we're working on in phase 2 of our research. We first set out to develop a conceptual framework for public mental health by identifying the important determinants of mental health in the population. We have 2 publications that are currently in preparation, which describe the process that we developed the framework, and what you see on screen is a snapshot of some of the visuals that have been developed for the conceptual framework. If you are interested in learning more about the determinants of public mental health and also exploring this interactive tool in more detail, please come to our workshop at 2 o'clock today, where we will walk through and provide some opportunity to explore and discuss the public mental health conceptual framework. There has also been a lot of work within the program on children and young people's mental health. This work has primarily focused on the school environment, trying to understand aspects of the school culture which support the mental health of children and young people. A study report that was released last year did focus on how young people's mental health was affected during the COVID-19 pandemic, and several more papers are currently being written up. We also conducted a series of reviews to highlight the best available evidence for public mental health interventions. The first was a review looking at working age adults facing financial insecurity. The next review was looking at community-based interventions for ethnic minority populations. And third, the final was a review looking at interventions for promoting mental health of older adults. We also conducted some mapping exercises where we explored the service provision across 5 different areas in England to identify current policies and practices. Public involvement is an important part of our program, and peer researchers have been embedded throughout every research project to ensure that we have experts by experience contributing to the research. One of the projects that they've taken on and developed is the IamPublicMentalHealth.com site. On that, they've created a COVID Life project, which highlights the experience of living through a public health crisis and the impact that has had on mental health. And it's brought in the voices of many people in the community and the different experiences during this time. There's also been a lot of co-production of all of our research, and also the peer researchers have led on the development of different newsletter articles and blog posts. So what's next for the Public Mental Health Program? Actively working on our second phase of research, where we're continuing to explore the promising interventions. We started the second phase in October, and we're continuing to research what works for public mental health for adults, older adults, and young people. We're using a range of methods from case studies, participatory action research, to big data analysis to try to explore these interventions and policies further. If you're interested in the work that we're doing within the Public Mental Health Program, we encourage you to sign up to be part of our network. The Public Mental Health Network brings together stakeholders to share emerging research and also opportunities to work together or to highlight current issues within public mental health. To join the newsletter sign-up sheet and the virtual network, you can go to the SPHR website to do so. Thank you for your attention, and if you have any questions, you can get in touch with us at publicmentalhealth@ucl.ac.uk. Thank you.
Hi there, welcome. Welcome to 5 Minutes on the Children, Young People and Families programme. I'm David, my buddy Ruth will pop up in a second, and a cast of thousands have contributed to this work from across the Children and Young People's programme, across the school collaboration. Child health outcomes in England and the UK are poor, inequalities are increasing. Our aim was to identify systems changes to address these wicked problems. Children's voices are very much at the heart of what we've done. We've worked with groups of children and young people across the country. Chili Pep in Sheffield produced this summary of what we did to begin with, looking at policy, looking at data, looking at inequalities across places in order to identify actions to improve health and reduce inequalities. We contributed to the COVID response. We know that children have been dramatically impacted. Their voices are essential in the recovery period. We highlighted that children continually emphasise the importance of being loved, safe, listened to, and while they don't deal with finances directly, they stress the importance of well-funded services and family finances to meet basic needs. The programme has influenced international, national and local policy. Why not start with some high-level messages for policy to address inequalities in child health across the life course? Systems need to act together, act early and act on time, and addressing child poverty and investing in children's early development is a prerequisite. We have 6 linked work packages that intersect with the other programmes of work. Here comes a very, very quick summary. Pause the video to get more detail once this is hosted online. Work package 1 was about looking at the policy context. Colleagues in Fuse and Sheffield have undertaken policy reviews and qualitative work on child health inequalities policy locally. Here's a quote from their study highlighting the impact of cuts to early years prevention for children. Those little cuts in every area, when you put them all together, have a devastating effect. We picked up this theme in work package 2, which was about harnessing and linking data to evaluate natural experiments with colleagues at UCL, Imperial and Liverpool. We've collated data on changing inputs and outputs to the child health system locally. The plots show changes on spending on different aspects of services for children over the last 10 years. Large increases in spending on looked after children, large reductions in prevention, more so in the most disadvantaged areas. All these data have been collated and made publicly available in our place-based longitudinal data resource. And we've used them in analyses to look at explanations for trends in inequalities in looked after children, childhood obesity and infant mortality. We've undertaken a major linkage of school level data linked to active involvement in the Daily Mile, a large at-scale physical activity intervention for children. There's ongoing analysis there. And we've used data linkage to understand inequalities in asthma in children and explored drivers for children being admitted for wheezing. And related to this, colleagues at UCL have developed a unique linkage that we're using to understand reasons for differences in admissions for young children, which are on the rise and vary a lot across local areas. So we've developed a mother-baby linked birth cohort in hospital episode statistics data, capturing data on 2.5 million babies. This work is ongoing, and linking to census data will allow us to look at the relationship between different indicators of disadvantage, for example, ethnicity and parental disability, on children being admitted. Over to Ruth.
Hello, I'm Ruth. I'm going to start by talking to you about Work Package 3. In this work package, Bristol and Sheffield universities aimed to map the child health system at a local level to reduce health inequalities. We created 2 maps in 2 contrasting areas of the country and then created a generic system map of local determinants of child health inequalities. This is the generic map which we created, which has several domains including the physical, governance, economic, social, services and personal domain. We hope that this map can be used by local systems to stimulate discussion about opportunities to intervene in child health inequalities. I'm going to move on now to talk about the 3 new work packages which have started in the last year. Work Package 4 is exploring children and young people's views of health and their understanding of inequalities in health, their priorities, and it will produce a toolkit of resources for children and young people. Work Package 5 is focused on the creation of integrated care systems and particularly the child health systems within those, and it will be evaluating the progress and the impact of those child health systems. And finally, Work Package 6 is aiming to create a network of 20 secondary schools with data collected from Year 8 and Year 10 young people on mental health and risk. The study will provide guidance for the creation of comparable networks in other areas of England. If you share our passion for making changes to improve inequalities in child health, please come and join us at the parallel session later and contribute your questions to the panel discussion.